current proving protocols. Okay, what is the current proving protocols? The three basic components of homeopathic pathogenetic trials are, okay, important. The testing substances already we have discussed in PowerPoint. Okay, the proving team, okay, personals, okay, means from who will be the in whole system, who will working in the whole system of drug proving, and the process or the methodology, that is important. Okay, what is the methodology? Okay, so this recent changes, okay, in the drug proving is similar with that. Okay, means what recent changes had happened, okay, that is same as Hahnemannian proving. Okay, most what is changed, most important change is the Hahnemann was using only the single blind method. Okay, but later on it come to the single blind and double blind. Okay, so the testing substances, okay, already we have discussed about these testing substances should be of pure and genuine quality. Okay, the drug proving is conducted on a healthy human being is noted for the disease producing is the disease curing power of a particular drugs. The drug is tested singly and along as a, because in the homeopathic system medicines are prescribed on the basis of law of similia. So that is law of similia similibus curanter. Okay, then the tested drug should be obtained from a reliable sources. That is, you should always use the genuine medicine for the drug proving. Okay, the testing dose, okay, for the testing dose, okay, that should be very small dose. Okay, minimum dose should be used for the testing. Okay, then next part is that sources, then you have to know the nomenclature, then its preparation. Okay, how will you prepare? Then low potency will be used. Then you have to know its toxicological effect. Okay, then you have to know its you have to use the placebo also. Then determination of dose, okay, means how you will determine the dose of the drug. Okay, then determination of dose, okay, by different stalwarts. Okay, then point second, the proving team or personals. Okay, that is important. Okay, what, who will be there in your proving teams? Okay, the proving team comprises of master prover, okay, important, or project director, then advisor or expert, then proving uh, supervisors and provers. Okay, these persons will be there for the drug proving. Okay, the drug proving is a comparative volunteer and teamwork of the different personals. Okay, remember it. Okay, means it is just a process of a teamwork. Okay, total teamwork is there. Okay, then master prover. Okay, master prover has some qualifications. The master prover is the chief person responsible for the entire proving project. Okay, okay, means all the responsibility is on the master prover. Okay, then B is the advisor or expert. Okay, advisor and expert has also some experience. Okay, they will advise or they will just give their expert comments. Okay, the advisor assistant for the proving director and provides his information regarding the details of the drug to be proved. Okay, then third is the proving supervisor or panel of investigators. Okay, there should be a panel of investigators that they will see about the quality of medicine, process of drug proving, everything is going correct or not. Okay, good alternative supervisor is one of the key factor in ensuring successful and fruitful food proving. Okay, proving is fruitful or not, that is can be seen by these advisors. Okay, then after that, provers. Okay, provers, the best possibility way of ascertaining the pure and peculiar effect of the drug is to provide drug on a healthy human being. Already we have discussed about this. These healthy persons on whom the drug is tested is obtained to the portrait of the medicine is called as a prover. Okay, means to on whom we are getting the characters of the medicine or the portrait of medicine, these persons are called as a prover. Okay, now methodology. Okay, already we have again discussed this in our PowerPoint. Okay, process of proving is not only the intake of the testing drug and recording the changes in the health, but requires, okay, meticulous planning and study before and after the proving. Okay, you have proper planning should be there, you should have a proper methodology should be there, and you have to pre and post preparation is important. Okay, so A is the pre-proving protocols. Okay, what is the pre-proving protocols you have to follow? Then proving protocols you have to follow, then post proving protocols you have to follow. Okay, the pre-proving protocols, okay, the study of the testing drug. Okay, which drug you are testing, that you have to just do the literature survey, you have to study about that drug properly. Okay, and you have to know about that drug. Okay, with the proper research. Okay, then selection of the supervisors. Okay, means you have to select the supervisor, that is also important. Okay, who is the experienced person and to whom you can rely for all this drug processing process. Okay, then selection of prover. Okay, how to select the prover, how can make you them like they will give their consent for just being a volunteer for the proving. Okay, a consent form having name, age, sex, address, and an undertaking is used to take the consent for the proving. Okay, like nowadays. Okay, nowadays we are just distributing the arsenic album 30 in Meghalaya. Okay, especially nearby Shillong. Okay, at that time we are giving them consent form. Okay, and we have just given them some other forms. Okay, that is already prescribed by the Ministry of Youth. Okay, that form they are filling and they are taking medicine, and we are doing the follow-ups. Okay, yeah, how they are feeling. Okay, means they are getting well or not, they are giving some positive response or not, that all these things. Okay, so this consent form is there, then some pro forma and form is also there. Okay, then personal select must be between the age group of 18 to 45. Okay, but here we have kept from pediatrics small child. Okay, to till 65-year age. Okay, but normally this should be 18 to 45. Okay, then the drug must be proved on both male female to get the changes produced in the sexual sphere. Okay, means already we have discussed about that. This drug proving should be on male and female both, so that we can understand the pathology and physiology of male and female both. Okay, then ethical consideration, we have to just go through all the ethical guidelines, and we have to follow all the ethical guidelines when we are doing the drug proving. Because inclusion criteria and exclusion criteria is important. Okay, to whom we have to include in our drug proving. Okay, suppose any person is there, they have already some disease. Okay, some problem is there, then we cannot consider in our drug proving. That is the not in our inclusion criteria, we cannot include them. Okay, that is called as a inclusion criteria. Okay, persons who has more ages, adult, okay, old persons. Okay, that we also not include, because that is not in our criteria. Okay, so just inclusion, to whom we are including. Okay, and exclusion criteria, to whom we are not including in our process of drug proving, that is called as a exclusion criteria. Okay, then instructions to the prover. Okay, all the instructions, all the rule, regulation, consent, what process we are doing, everything we have to just inform to prover. We cannot hide anything. Okay, we have to give, it is the responsibility of the head of the proving team. Okay, to give all the information to the persons or provers on whom we are doing the drug proving. Okay, means we have to give all the details of the methodology, all the details of the documents, and all the details of the process of proving, we have to inform them. Okay, the instruction what we have to give to the provers. Okay, then after that, the proving protocols. Okay, we have to follow the protocols. Okay, in these proving protocols, multi-centric trials are there. Multi-centric trials means we are not doing our drug proving only at one place. Already we have discussed about this. Okay, we suppose we are doing one proving in Meghalaya, we are doing one proving on Kolkata, we are doing one proving in the Ernakulam or the Kerala. Okay, because we have to just take the places like hilly area. Okay, this normal plain area, and we are taking the places like seashore. Okay, so we cannot do proving only at one place. Okay, how much possible multi-centric trials is important. Okay, that will give you. Okay, then orientation meeting. Okay, in between trials we have to keep a meeting. Okay, that may be like meeting, may be like by conferencing or other way. Okay, just we have to keep a meeting. Okay, so that we can just go through the all the process ki, what we are doing is correct. Okay, what result they are getting, what result we are getting, that should be properly discussed. Okay, then nature of the trials. Okay, since 1948, randomized controlled trial has become the standard design for drawing and conclusion of the effect of the medicines. Okay, these the requisite of randomized control trial. Randomized trials, okay. Randomized trials are those to which the subjects and experiments are randomly placed either in the treatment group or in the placebo group. Okay, means what is the random? Suppose you have taken a 50 student. Okay, you are not just selecting. Okay, pupil. Ki this we have not just made a 25 group. Okay, just we have randomly. Okay, randomly 25 persons we have given the random. Okay, it is not suppose 1 to 50 roll number is there. Okay, first 1 to 25 we are giving the placebo, and 26 to 50 we are giving the medicine. Okay, this is not randomized. Okay, we have properly selected. Okay, but when we are doing the random selection, I have given 1, 5, 7, 9, okay, 10, anyone we are, okay, 25 we have selected, and we are given the this placebo, and just who are left to whom we are giving the medicine. This is the randomized. Okay, we are not selected anything, just randomly we have given the medicine and placebo. This is called as a randomized control trial. Okay, then next is the um, this is the randomized placed either in the treat group or in the placebo group. The research attempt in to place pupil with the similar characteristics is equal number in the treatment and the placebo group. This process is helpful for the reducing the bias. Okay, means when you are doing the randomized control, it is better. Okay, means double blind randomized trial is best trial. Okay, means suppose you are selecting person from the only one place or one locality. Okay, then it is not a good trial. Okay, you are selecting person from different localities, okay, different regions and different areas. That is the good trial. Okay, then second is the double blind trials. Okay, sometimes it comes as a short note. What is the double blind trials? Okay, double blind trials are referred to the experiment in whom neither the experimenter nor the subject know whether a specific treatment was prescribed or placebo or fake medicine has uh, uh, took and tested like real homeopathic medicines. The double blind medicines cation is proving trials were suggested by the trials whether neither the proving members and the provers volunteers know the name of the drug and these potencies of the drug of the control received by each of the prover. Okay, so this double blind trial already we have discussed ki both the prover and the person who is conducting the proving both are not knowing about the medicine and its potency. Okay, and this is the good way of doing the drug proving. Okay, in India the authority has adopted Hahnemannian concept of proving of drug on the healthy human volunteers with modifications based on the trials double blind techniques. The crossover design is followed during the entire continuation of drug proving. Okay, mostly in India we are doing this randomized double blind clinical trials. Okay, that is the best way of clinical trial. Okay, then this process is like we do the coding on the person, we do the coding on the medicines, and we give the medicines. Okay, next is the crossover studies. Okay, that is double controlled studies. Okay, then after that the controlled trial placebo. Okay, then the committee. Okay, then after this single blind trials, double blind trials, controlled studies, we just on the committee. Okay, we get the things. Okay, what is there in the what we got. Okay, by the day book or day diary. Okay, whatever is written by the uh, provers. Okay, prover may be of two types. One is the one prover may be literate, one prover may be illiterate. If prover is literate, okay, it is well and good. We don't need to ask anything. They are just what they are feeling. They will write. Okay, if prover are illiterate, every evening, okay, we have to go to them and we have to ask them. Okay, and if prover is literate, what they are writing, that also we have to check. Okay, and this committee they just take all the symptoms and they just analyze the symptoms. Okay, then the protocols. Okay, the process of proving commences with the orientation meeting. Okay, means first we will give a meeting, we just inform all the things to the prover, and after that this starts. Okay, then the instructions regarding the proving details to the prover and to the day book are distributed. Okay, then provings are provided to the prover in a coded phases. Okay, and provings are divided into two groups. Okay, which one is placebo, one gets placebo and other gets the medicine. Okay, Then as per recommendation, just we give the medicine, okay, for like provided for four to six globules, okay, morning and evening for 4 to 5 days, okay. That is up to depend upon the process of proving, which is already discussed, okay. Then recording of the symptom, this recording of symptoms is done on the day book or day diary, okay. Means this is just by the day book or day diary they do the recording, okay. Then guidelines for the recording of the symptoms, okay. Symptoms should be recorded, okay. Like what are the additions to the protocol? Honesty and sincerity are prerequisite both on the part of investigator and the subject, okay. On the investigator and prover, both should be honest, okay. I have told in the starting of this chapter, okay, I have told ki honesty is important in the process of drug proving, okay. There should not be any type of prejudiciation. Honesty is important, okay. Then the prover must take the day book entirely, list 3 times a day to prevent either minor memory lapse. Okay, means what they are just writing in day book, everything should be checked every day. Okay. Then all this way of minimizing error, okay, means how you can minimize the error, okay. The subjects are assured that the information will be treated as a confidential, okay. What information they are giving, that should be kept as a confidential, okay. Then post proving protocol, what you have to do, okay, this is very much important. After proving is done, okay, the work of prover is done, okay. Now this proving team, okay, who are the experienced persons, okay, they will come together, they will keep a meeting, they will start reading all the day books, okay, and they will just take out the symptoms, okay, just they write at one place all the symptoms, and they will start analyzing the symptoms, okay. And these symptoms can be written from head to toe or according to the by the day, okay, timing, like today they got this symptom, tomorrow they yesterday they got that symptom, okay. All on the, there may be two sequence, okay, like from head to toe by the your body order, okay, or otherwise it will be timing, okay. It means on the first day they got headache, on second day they got whole body pain, on third day they got stomach pain or anything, okay, like this, okay, on this order, okay. So both order they have to, and when they will just compare all the symptoms, okay. Well, like suppose we have taken 50 volunteers, okay, that will be, means that is the full, okay, strength review or the hard work, okay. Then analysis of proving records, okay, analysis will be done, okay. Then after that analysis, okay, that you have to just give all these things to the uh, your higher authority, okay. Means they will just see all these things, okay, and when higher authority will be just approve this will go for the publications, okay. So this is the total process of drug proving, okay. And after that, okay, the drug proving minimum standard for homeopathic pathogenetic protocols, okay. Now there are various committees are there, okay, like European committees, okay, American homeopathic pharmacopoeia, they have just slightly changes there, okay. It is not like that totally changed, okay. Everyone is following the classical Hahnemann's protocol, okay, but slight changes are there in the process of drug proving, okay. So now just from start we will see, first we have discussed about the, okay, definition of drug proving. Then we have seen about the history of drug proving, history of drug proving on the all over world, and history of drug proving in the India, okay. And after that we have seen about the aphorism relation with the drug proving, okay, how it is related in our aphorisms, okay. Then after that we have just gone through the protocols of drug proving, okay, like what will be the criteria of drug proving, okay. Means what will be the method, genuine medicine, then there should be a total teamwork, okay. And after that the methodology of drug proving, okay. Then in methodology of drug proving, pre-drug proving protocol, drug proving protocol, and post-drug proving protocol, okay. In pre-drug proving protocol we have to do all the compilation and all the work and preparation for the drug proving, okay. Means we have to just uh, put all the documents, okay. We have to give take consent from the provers, okay. Then in the committee we have from proving director to prover, the total team will be there, okay. And now in proving process methodology, okay, there should be a uh, in proving method you have to just take the genuine medicine, and there will be two methods: single blind method, double blind method. Single blind or double blind method may be randomized control trial. Okay, in randomized control trial, you can take the provers from different places, and you should not be biased. Okay, then there should be a day diary or day book. Okay, in day diary or day book, all the things should be written by the prover. Okay, you have to take consent from the prover, and you have to inform all the process to the prover. Okay, after this proving is completed, you have to, a meeting should be there, and this all the day diary or day book should be collected, and it is analyzed properly, and all the symptoms are collected. Okay, after the collection of the symptoms are again analyzed properly. Okay, and after the analysis of symptoms, these symptoms go to higher authority. After their approval, these symptoms are published on the any journals, or they are just by the government government consent. These are just written in these just come in the book of Materia Medica. Okay, this is the total process of drug proving. Okay,